So meron tayong drugs for emergency or nakalagay siya sa emergency cart. So why is it included in our discussion right now on dispensing? Okay, drugs for emergency class, they are stored in emergency room. So doon sa emergency room, meron tayong tinatawag na special cart na naka-store itong mga nasa table natin ngayon na drugs. Meaning to say, if there is an emergency situation in a patient that comes in the ER, doon nila kukunin yung gamot. So, naka-stock na siya doon, na-inventory siya all the time so that kung gagamitin siya, updated siya, mag-reflect siya sa system ng pharmacy. Hindi na mag-wait pa ng doctor or ng doctor to create or to write medication order, tapos kukunin doon sa pharmacy, tapos i-transport pabalik sa ER. So pagbalik ng rounder doon sa ER, patay na yung pasyente natin. So itong mga drugs for emergency, nandoon siya sa cart or emergency cart. So if you are hooked in watching mga series, yan, meron tayong mga series where you can see medical series where you can see yung sa emergency room like sa Grey's Anatomy, may mga medical chart na ginatuklod-tuklod nila na ay mga tambal kung mag-resuscitate. So, ayon siya ang tinatawag yung emergency box or emergency cart. So, it's the clinical pharmacist who assist the doctor to and dispense o paghatag dito sa doctor mismo or sa nurse sa tambal. But not all hospitals have clinical pharmacists, but in St. Luke's, Makati Med, okay, nag-refresh akong net. So, na-save si Harvey. So, Harvey, are you there?
Yes, ma'am.
Did you hear my instruction kanina? Sige daw. You choose or you, with the drugs that I have presented here, ano kayo yung mga medical emergencies na that leads to utilization of these drugs? Kung may familiar sa'yo dyan, pili ka lang ng isa.
Wait lang, ma'am.
Isa lang.
Kanang ano, ma'am? Phenobarbital.
Phenobarbital. Sige daw, si phenobarbital is useful for
Ano, ma'am?
is useful for SE. What is SE? If sudden SE occurs in the ER, this is given immediately to the patient.
Barbiturates? Ay,
Barbiturate, it is useful for status epilepticus or pwedeng mga grand mal seizure kanang mukalitra og kanang makalitra og seizure ang patient tapos grand mal minto say mag tibok lawas niya jud ang naga seizure. So pwede bigyan ng phenobarbital. Okay, let's have another student. I will call 3 students. Abigail, followed by Erica. Sige, choose one.
Sino po na Abigail?
Ay, may...
Parba?
Wait, Abigail Parba. Ikaw po.
Ay, okay po. Ano, ma'am? Norepinephrine.
Norepinephrine. Okay, this one.
Wait lang. Yes, ma'am. Yeah, norepinephrine.
Pareho sila ni epinephrine. So, para asa sila, Abigail?
They are neurotransmitters po, ma'am. Tama ba?
Yes, they're natural neurotransmitter, si epinephrine. That's the adrenal oxygen. I will accept that, but for what condition?
Ma'am?
For what medical emergency siya binibigay? Si epinephrine or si adrenaline? Ano yung condition ng patient? Kailan siya?
Ayan. Kuan man pagka naging may mga allergic reactions or something.
Okay, anaphylaxis. So, pwedeng bigyan ng epinephrine para anaphylaxis. So, na-mention na word, anaphylaxis. Aside from anaphylaxis, your epinephrine and norepinephrine, they are useful in resuscitations. Okay? In between, parang ito, sorry class. In between resuscitation nga, yun, binibigay siya mga how many cycles? 3 to 4 cycles. If hindi kaya, that's the time the doctor will try. If the patient is not responding, then they will stop the compression, check compression, and then they can declare if the patient is not responding, they can declare death. So, hindi pwedeng too much of epinephrine ang ibigay natin sa patient because the heart also cannot receive too much. Okay, next one. Who's the... sino yung tinawag ko kanina? Eloisa ba yun? Ay, Erica. Rezani.
Erica, ma'am.
Yes. Sige daw.
Hydrocortisone, ma'am.
Okay,
Steroid
hydrocortisone.
hormone for inflammation, ma'am.
Okay, so that's very useful, especially right now in our COVID situation. Why? Hydrocortisone. It was flashed. It was reported in different channels na corticosteroid is useful daw in COVID management, but that's not a new drug, diba? Are you aware of that, class?
Yes, ma'am.
So, mura sila naratol, no? Abi nilag bago ang corticosteroid, ang hydrocortisone, mga cortisol. They do not know it. So, para asa siya, si hydrocortisone? Erica? Erica? Sige daw,
Hello,
anyone.
ma'am. Nadungog ko, ma'am.
O sige. So, para asa siya?
Usahay ay kuan po siya, ma'am, kanang steroid hormone po siya, ma'am, na gina-prescribe po siya, ma'am, sa patients na nag-require of replacement therapy for adrenal insufficiency, ma'am.
Okay, for adrenal insufficiency, that is an emergency situation also. Okay, so it addresses inflammation or hyperactivity of our immune system. Pwedeng bigyan ng hydrocortisone yung patient natin. So it is given initially to subside activation of your inflammation process. Kasi kung mag-progress ang inflammation, pwedeng mag-collapse ang lungs, pwedeng diretso-diretso na siya mag-inflame, mag-activate ang tibuok cascade sa body ug mag-arrest ang patient. So maka-help si hydrocortisone indirectly with the management of emergencies. Okay? So in your assignment that should be submitted tomorrow, you will be assigned with an emergency drug, and then you will present it nandito sa ating Google Classroom. You will create a presentation. Nandyan sa Google Classroom natin. Ay, hindi ko pala na. Sige. Sige. Check yung Google Classroom later ha. I will apply the instruction. Wala siya nag-appear. So, yun yung gagawin nyo from 9 a.m. to 11 or until tomorrow. So, ito yung emergency part natin. And then, okay. So, yun lang. Hello? Okay lang sa inyo, yun na lang